Heart disease is the #1 killer in America, men and women. Now a new study says stressful jobs can double a man's risk of developing heart disease. Dr. Majid Basit joins us this morning from Memorial Hermann Medical Group to tell us more about this and to wake us up about this. That's a crazy stat right there. I mean, we've got a serious problem. Is this worse for men than women? Why?
Well, that's a very interesting question. So this study showed that men, much more than women, have more heart disease earlier in life than we expected. And a lot of it points towards job stress, and the lack of risk, effort reward. That means that when you work hard, you're not getting rewarded. And so it's very important for us to find jobs that we are happy with, that we are appreciated at.
And you need to really feel fulfilled and realize if you're being stressed out. I think a lot of us just expect to feel stressed, or we don't even realize what stress is doing on our bodies. How can we tell if it's starting to take a toll? I mean, this needs to be an awareness campaign about what it's doing to the heart.
Absolutely. And think about how you're feeling. Are you anxious? Are you depressed? Are you having trouble sleeping? You know, talk to your friends and family that you trust. Talk to your doctor. Make sure your doctor is asking you questions about your feelings, about your job stress, your family stress, your financial stress, anything that could be doing something bad to your health.
I think a lot of times when we think about problems with the heart, you might picture someone who's eating a lot of greasy food, maybe obesity, perhaps someone who smokes all the time. How does a stressful job rank with two of those factors that have been proven to cause heart disease?
Surprisingly, it's more likely to have, you're more likely to have heart disease and heart attacks.
Wow.
Even more than obesity or other factors.
My goodness. And I think that's hard for us to understand because it's something you can't measure, right? With obesity, we can see it. If someone's smoking, you can see they're doing that to their body. With the stress of a job, you don't see it. Obviously, you can feel it, though.
So I treat high blood pressure, high cholesterol. I look at numbers. There's no number for stress.
Okay, what do we do about it? That's what I want to know. I mean, I think maybe a man too, especially if he's married, he feels like he's the man of the family. He's got to make sure the family's taken care of. He doesn't want to leave the job to find a more fulfilling one. So if he's in that role, how do we help him de-stress and make sure he's safe and healthy?
So find things that you enjoy to do, whether it's with your friends or with your family. De-stress. Find opportunities to get away from your job and enjoy life. And we just had the last story talked about how maybe you're not happy until you retire.
Yeah.
That's wrong.
Don't wait until 70 to be happy. But what if you don't make it to 70?
Exactly.
So you've got to find happiness now. Can you counterbalance that if you do find things you love, whether it's golf or reading a book or whatever it is? Can doing those things you love counterbalance some of that stress and make you healthier?
Absolutely. I have friends that are emergency room doctors, nurses, that have a very stressful job, but they counterbalance that with many things that they enjoy.
And so how do we keep a check on that? Because we may say, okay, I'm doing all these hobbies, I'm all right. How often do you need to get your heart checked? And then what tests do you want someone to really consider doing?
So really the main thing is the normal stuff, the blood pressure, the cholesterol, but really having that conversation at least once a year with your doctor and saying, hey, talk to me about stress. Ask me some questions about depression. Help me cope.
And know your numbers, like you said. Make sure you know those numbers and then do something about it if they're high, right?
Absolutely.
Thank you for taking time for Memorial Hermann. Important conversation. Things like this, you never know. It could save somebody's life, and that's our hope for sure.
Happy. Thank you, Melissa.
All right.